The levodopa, the most effective Parkinson's disease medication. It is a natural chemical that passes into your brain and is converted to dopamine. Levodopa with a selective extracerebral decarboxylase inhibitor, for example carbidopa, is the most effective treatment for most patients with Parkinson's disease. Let us investigate its mechanism of action. Levodopa is the immediate precursor of dopamine and is able to penetrate the brain, where it is converted to dopamine. The site of this decarboxylation in the Parkinsonian brain is uncertain, but as dopa decarboxylase is not rate-limiting, there may be sufficient enzymes in the remaining dopaminergic nerve terminals. Another possibility is that the conversion occurs in noradrenergic or serotonergic terminals because the decarboxylase activity in these neurons is not specific. In any event, the release of dopamine replaced in the brain by levodopa therapy must be very abnormal, and it is remarkable that most patients with Parkinson's disease benefit, often dramatically, from its administration. Adverse effects are frequent and mainly result from widespread stimulation of dopamine receptors. Nausea and vomiting are caused by stimulation of the chemoreceptor trigger zone, CTZ, in the area postrema, which lies outside the blood-brain barrier. This can be reduced by the peripherally acting dopamine antagonist domperidone. Psychiatric side effects are the most common limiting factor in levodopa treatment and include vivid dreams, hallucinations, psychotic states, and confusion. These effects are probably caused by stimulation of mesolimbic or mesocortical dopamine receptors. Remember, overactivity in these systems is associated with schizophrenia. Postural hypotension is common, but often asymptomatic. Dyskinesias are an important adverse effect that, in the early stages of Parkinson's disease, usually reflect overtreatment and respond to simple dose reduction or fractionation. Although levodopa works magically in treating Parkinson's patients, however, after 5 years treatment, about 50% of patients will have lost ground. In some, there is a gradual recurrence of Parkinsonian akinesia. A second form of deterioration is the shortening of duration of action of each dose of levodopa, end of dose deterioration. Various dyskinesias may appear, and with time, many patients start to experience increasingly severe and rapid oscillations in mobility and dyskinesias, the on-off effect. These fluctuations in response are related to the peaks and troughs of plasma levodopa levels. Carbidopa, which is a dopamine decarboxylase inhibitor, diminishes the metabolism of levodopa in the periphery, thereby increasing the availability of levodopa to the CNS. The addition of carbidopa lowers the dose of levodopa needed by 4 to 5 folds, and consequently, decreases the severity of the side effects arising from peripherally formed dopamine. Let us move ahead and discuss some dopamine agonists next.